Hi friends, I'm Dr. Pratap Smatur. I have done the MD in Pharmacy Medicine, and today we'll discuss about poisoning by nitric acid. Nitric acid is also one form of corrosives, and it has sign symptoms statement and most of the postmortem changes similar to that of a sulfuric acid poisoning. Coming to physical properties of nitric acid, it is also known as aqua fortis. It is a form of clear, colorless, fuming, heavy liquid that has peculiar and choking odor whenever it is smelled. In concentrated form, it combines with any organic matter and produces yellow discoloration to form a picric acid. This is known as a xanthopoietic reaction. This is very important because sulfuric acid doesn't have this type of property, but nitric acid when combined with like skin, anything, it turns into a yellowish discoloration which indicate which type of acid poisoning was there. Coming to signs and symptoms, as I mentioned, these are similar to poisoning by sulfuric acid. In this nitric acid peculiarly, there is more erections and greater abdominal distensions owing to gas formations. It causes yellowish discoloration, as I mentioned, of the tissues, including the crowns of the teeth and yellow stains on the clothing. It causes yellow stain. Then inhalation of fumes causes lacrimation, photophobia, irritation of air passages, lung produces sneezing, coughing, dyspnea, asphyxia, has similar to of sulfuric acid. Also, color of urine in this citric acid becomes brownish in discoloration. There is corrosion of mucous membrane of mouth, throat, and esophagus, which causes burning pain, standard drooling, rodophagia, and dysphagia. This is again similar to sulfuric acid. Mainly, if the person has consumed nitric acid through mouth, it causes corrosion of mucus, and person may not be able to speak properly, may not to drink or eat properly. There is epigastric pain, which full space all of the abdomen and thorax. There is a pharyngea pain, most common presenting symptoms. Then there is circulatory collapse may also occur immediately, and death may occur immediate death because of circulatory collapse, and also death may occur because of asphyxia due to edema of the glottis. Coming to fatal dose of nitric acid is 10 to 50 ml. If it is consumed, it will cause death, and fatal period is 12 to 24 hours. That is the time period which the person may survive if we treat it within 24. After 24 hours, he will be able, within 12 to 24 hours is the fatal period within which the person who has consumed nitric acid fatal dose will die. Coming to treatment part, again it is similar to of sulfuric acid. As any corrosives, gastric lavage is contraindicated or antibiotics are contraindicated in case of any corrosive poisons. The acid should be diluted, not utilized by bicarbonates because it produces gas. So it should be diluted and utilized in situ by giving 1/4 liter of water or milk of magnesia, lime water or soap. We also can give demulcents like olive oil, milk or egg whites which prevents damage caused by the acids. Then prednisolone 60 mg per day is usually given to prevent scarring for scar formations. Then skin burns are washed with large amount of water and paste of magnesium oxide or sodium bicarbonate, which neutralizes the acid. Because in outside, the bicarbonates can be used as a form of neutralizing the acid since the gas produced is evaporate in the environment. Eye burns irrigated with water as well as with soda carbonate to neutralize the acid. And further management is given has symptomatic treatment. Since sulfuric acid and nitric acid are not absorbed, there is no antidote. Just we have to dilute or treat the symptoms caused by the acid, mainly the corrosions and ulcerations has to be treated to prevent scarring should be prevented, and much rest is given for the treatment. Then coming to postmortem changes, they are those of sulfuric acid. Tissues are stained yellow in color. This is a peculiar change which is present in the nitric acid because of xanthopoietic reaction. The clothes should be examined for any burns and stain marks, which if it is present. The esophagus and stomach corrosions or mucous membrane may not be accompanied by loose discoloration, which may appear brown or black due to erythema. This is one of the feature which has to be distinguished because sulfuric acid, citric acid, even though it produces xanthopoietic reaction, but it is not accompanied in case of mucous membrane of esophagus stomach, where it produces acid hematine leading to brownish or blackish in color. Stomach wall will be soft, friable, and ulcerated. Perforation of stomach is not common, but extensive areas of mucous membrane of stomach and esophagus are sometimes detached. So perforation, which is common in sulfuric acid, is not common in case of nitric acid, but the damage is caused because of damage will be present. Death from inhalation of fumes, larynx, trachea, and bronchial tubes are congested. Lungs are edematous because of asphyxia and because of inhalation of the toxic fumes. Secondly, toxic swelling of liver and kidneys is seen if the person survives longer. Inner tubules may show necrosis, primarily in proximal columnar tubules. There may be renal failure. Necrosis lead to renal failure. Coming to test for nitric acid. So those are the few question appraise. Coming to confirm that the person has consumed nitric acid, the test sample, like mainly the body fluid, is collected, and test is done to detect the presence of nitrates. This is done with when the testing fluid is mixed with ferrous sulfate solution and sulfuric acid solution. It causes a brownish ring formed at the junction of two fluids. This indicates that there is a presence of nitric acid. Coming to circumstances of poisoning or medical importance of nitric acid, most cases of poisoning are results of accidental or suicidal. Accidental mainly in case of laboratories, because the person may be accidentally consumed, or because someone has tried to consume by suicide. Homicide by acid is very rare. It is very difficult to know. These are my references. Thank you.